Hey everyone, so today we're going to tackle a big topic, one that you've definitely heard about diabetes. It affects millions and millions of people. But what does it actually mean? What's going on inside the body? Well, that's exactly what we're here to break down. Let's get into it. So, before we really dive deep, I want you to keep one question in mind. Just tuck it away for a bit. We're going to talk about a few different types of diabetes, but believe it or not, they all share one single core problem. I want you to see if you can figure out what it is as we go along. Okay, first things first, what even is diabetes? Okay, so this is the textbook definition from the American Diabetes Association. It sounds a little complicated, right? Metabolic disorders, glucose is underutilized, but let's cut through the jargon. It's basically all about how your body handles energy from food. And, did you spot it? The last word there, hyperglycemia. That's just a fancy way of saying high blood sugar. And that, right there, is the one thing every single type of diabetes has in common. It's all about high blood sugar. But let's make it even simpler. I mean, way simpler. At the end of the day, it's really just a problem with how your body uses sugar for energy. That's the whole shebang. The sugar you eat is supposed to fuel your cells, but with diabetes, it kind of gets stuck outside. It can't get in to do its job, so it just builds up in your blood. So that leads to a pretty important question, right? Could you be at risk? So take a look at this list. I mean, just scan through it real quick. Do any of these ring a bell for you? We're talking about things like your age, whether it runs in your family, high blood pressure, even just how active you are. You know, the American Diabetes Association says everyone should get screened starting at age 35. But if some of these other factors apply to you, your risk might be a little higher, even sooner. And to make this super easy, the ADA actually has this really simple test you can take. It's nothing scary, I promise. It's just a handful of questions that asks you about some of the stuff we just saw. Your age, your family, that kind of thing. You get points for each answer, you add them up, and it gives you a quick snapshot of where you stand. It's a fantastic little tool. So if you were kind of following along, did you end up with a score of 5 or more? If you did, the ADA suggests, hey, maybe it's a good time to just chat with your doctor. And I want to be super clear here. This is not a diagnosis. Not at all. It's just a little nudge, a heads up, that it might be worth having a conversation about. Okay, so let's say you do talk to your doctor. What happens then? How do they actually diagnose this stuff? Well, it really comes down to 3 common tests. First up is the A1C test. Think of this one as the big picture. It shows your average blood sugar over the last 2 or 3 months. Then you've got the fasting plasma glucose, or FPG. That's more like a snapshot. What's your blood sugar right now after you haven't eaten all night? And finally, there's the oral glucose tolerance test, which is basically a stress test for your system. They give you a sugary drink and see how your body handles it. And what's really great is that there are very specific numbers for these tests. It's not a gray area. You can see it right here. If your A1C is 6.5% or higher, that's a diagnosis. If your fasting glucose is 126 or higher, that's a diagnosis. It's all very clear-cut, which is exactly what you want. Now, getting a diagnosis isn't the end of the story. The next big question is, what kind of diabetes is it? Because, yep, there are different types. Okay, so the 2 big ones you hear about all the time are type 1 and type 2. With type 1, the body basically attacks itself and just stops making insulin completely. It's an all-or-nothing situation. But with type 2, which is way more common, the body is still making insulin, it's just either not using it the right way, that's called insulin resistance, or it just can't keep up with demand. It's not making enough. And believe it or not, that's not all. There are other classifications too. You've got gestational diabetes, which can pop up during pregnancy. And then there are some much rarer types, like monogenic diabetes, which comes from a single gene issue, or even diabetes that's caused by problems with the pancreas itself. It's a pretty broad category. All right, let's switch gears a little bit, because a diagnosis can sound scary, but it's really just the starting line for management. So let's take a quick look at what that actually involves. When you boil it all down, management is really just one thing. It's a balancing act. Seriously, that's the whole game. And this is the perfect way to picture it. It's like a seesaw, right? On one side, you have the carbs you eat from food. They push your blood sugar up. And on the other side, you've got insulin, which brings your blood sugar back down. The goal every single day is to keep that seesaw as level as possible. It's all about that push and pull. So let's talk about that up side of the seesaw for a second. Carbohydrates, or carbs. This is your body's #1 energy source. We're talking bread, pasta, fruit, you name it. And the reason they're so key here is that when you eat them, your body breaks them down directly into glucose, which, remember, is blood sugar. That's the direct link. And here's what's so important to understand. Managing all this, it's not a guessing game. It's not random. It's a logical, step-by-step process. You look at your numbers, you find the patterns, and you make little adjustments. It's 100% a skill that you can learn and get really, really good at. But, and this is so important, especially for anyone with type 1 diabetes. For them, insulin isn't optional. It's not just helpful, it's essential. This quote says it all. The insulin infusion must never be stopped. Because their body doesn't make any on its own, it has to be supplied constantly. It is quite literally a lifeline. So there you have it. We've covered what it is, who might be at risk, how it's diagnosed, and the absolute basics of management. You know they say knowledge is power, and you've just armed yourself with a whole lot of it. So the real question now is, what are you going to do with it? What's your next step? Maybe it's just learning more, or maybe it's having that talk with your doctor. Whatever it is, you're starting from a much better place now. Thanks so much for joining me.